At the Australian Childhood Foundation, we work with so much pain and so much trauma that has occurred in the lives of children. We're constantly looking for ways to help kids recover, to engage the resources around them, the people around them in relationships that are going to help support them and really leave the impact of the trauma behind as they grow older. And that's why Sensorimotor Psychotherapy and the partnership that we have with Pat Ogden and her institute is so important to us. It means that we're able to bring to Australia a way of working that's respectful, a way of working that is positive, it's resourcing of children, and it doesn't need words, and that's probably the most essential element of it.
The important thing, which is something for both level 1 and level 2, is also learning for myself as a therapist about how to manage myself and the importance of tracking what's happening for myself within my body as much as tracking for a client. And I think that's been really helpful. So the difference it made to my work was both in terms of that I mainly supervise staff, so giving staff resources to how to help people when they're telling their stories, children, how to help parents when they're telling their stories, to notice what's happening within their body and to track that, to make sure that people aren't leaving more traumatised when they came, helping them really integrate as well the trauma that they have experienced, you know, both from that sensory level as well as a cognitive level. So, and doing that in small pieces, realising to do that in really small pieces.
One of the most important things I learned in level 1 in the trauma training was learning how to work with the window of tolerance and being really strong and really confident in managing states of arousal. Yeah, that was really important. I knew the concept and worked with it prior to that, but it really cemented my understanding of it, and that was really, really important. I had done a fair bit of training in trauma, bits and pieces, you know, courses, and there was still something missing for me. The body seemed to be the place to go. One of the things I loved about level 1 was that right from the first block, I could use that in my work. I could apply it straight away. Some of it was just about seeing things through a different lens, but there were essential skills that I could apply right from the first block. The thing I used most in my work was probably using the body as an access route rather than cognitions or emotions, starting with the body and really bringing that to the forefront because it's so rich. And with trauma, it's everything, really. So yeah, so that was firmly established by the time I finished my training.
I think working therapeutically for about 15 years and just feeling like there was really a gap in my knowledge in terms of how to respond to really physiological activation, I guess, and obviously being trained primarily in more cognitive and emotional ways of working with people, it really felt like, I was hopeful that the sensorimotor training would kind of round that out and help me to be able to work on all levels with people in terms of their experience, or to work cognitively, emotionally and with the body. It was quite challenging but really exciting to kind of begin that shift from working more with narrative and story to working with the present moment and working with what's actually happening, you know, for the person in the room at the time. But also to understand, be exposed to all of that relevant neuroscience, to really feel like I was starting to get a much kind of clearer and more comprehensive overview of the research behind trauma therapy, and to start to feel a little bit more confident about processing some traumatic memory in a safe way.
Well, I hope that students will walk away with a real embodied sense of that idea of inner intelligence for themselves and their clients. And also, I hope that they will walk away with a new kind of relationship to embodiment, and kind of an honoring and valuing of the body. And see, because once they really get that, then all the techniques and everything will just come out of that kind of context,